it's the tip of the iceberg. Yeah. We've studied 120 trial bundles, but these trial bundles specifically was geared to look at what the nurses were doing. But I must say, of the 122, 43% included nurses and doctors. But our emphasis was to look at what the nurses were doing from the time the patient was admitted to the hospital until the patient was discharged, to look at exactly what they were doing and what was not being done. And surprisingly is that we found that something like 93% of the cases were clinical manifestations. And if one speaks about clinical manifestations, it's that the care that we are giving to our patients, listening to our patients, whatever the patients are saying to you, or what the response to blood pressures, urine output, the IV therapy that they're getting, it's all about the patient. It's direct care. And we need people to take care of our patients that are critical thinkers, that are able to analyze holistically our patients, and to be able to do nursing diagnoses and to plan accordingly, which we found that was not done.
I'm interested
that are presenting to the mid. Yes.
All right, Professor, I'm interested in the reasons for this malpractice, because when we speak of similar cases in the public sector, you'll hear about how hospitals are short-staffed, they're overburdened, there's a lack of equipment. How does the private sector then explain things like nurses not being able to interpret certain things, not checking on patients as regularly as they should?
The unfortunate thing is that most of the nurses that are nursing patients are actually not, if it's a critical care unit, they're not critical care trained nurses or registered nurses. These are staff nurses or caregivers, and caregivers don't belong in acute hospitals. Really, we've completed research on that, and I found that they look upon themselves as nurses, and others look at them as nurses as well. And consequently, they also do the work that nurses have to do. The problem is that we find that our registered nurses are glued to the offices, and they have so much other admin work to do that the staff that's taking care of direct patient care are substandard. It's unfortunate I have to say it that way, but that is how it is. And I'll give you an example. If a patient comes out of theatre after a bypass, you know, a bypass, when you speak about a heart attack and bypasses and those things, people, the public, are really, they become concerned. It's something so critical. In fact, they expect anything, you know. And then we find that staff nurses are nursing our patients. These patients should be nursed by sisters, registered nurses, or people, or being supervised by a critical care trained nurse. In many other hospitals, in the overseas hospitals, you find critical care nurses taking care of patients. In fact, many years ago, I was on a study tour in the States, and we found that the registered nurses nursing, applying direct patient care, they had PhD degrees. They were so well equipped. So consequently, the adverse events are less. Our staff that are nursing our patients in the private sector are not equipped. The training, the results shows that the training figures are low. They're not interpreting the results, the response to patients. Let me give you an example. If a patient's blood pressure is high, or there's a tachycardia, very high, an increase in the pulse rate, they're not responding to it. They're writing down the results. And then you get examples where patients have spinal cord surgery, which is now not just of writing down from the monitors. You basically have to check those patients, the limbs. If it's lower back surgery, you go and you check if there's the patient is able to move those legs. Do the patient have sensation in the legs? And there was one of the cases where a patient was actually saying to the nurses at about 11:45 that, look, my one foot was a bit lame, but now the other foot feels weak. And it continued progressively, his legs became weaker, and by 5 o'clock he was basically paralyzed.
All right.
Now, what was wrong here is that there's, yes.
Prof, unfortunately, there's so much to discuss, but
what to do.
We are unfortunately out of time. We're going to have you back on here on the channel for a longer conversation about issues around the cost of these lawsuits and how they transfer to the rest of us as customers. But for now, thank you so much for your time this afternoon.